I know the governor announced this morning, but what would be the requirements if anybody would be interested in applying to be one of these scholarship program applicants for this program?
We're still filling out some of the details of the program, but the basic gist is if you want to go and get your RN or your RN to BSN, there's scholarships available for you, like in other fields like the STEM field and other things to fill critical workforce needs. And I think it's a huge step forward. I think Governor Hochul has her pulse on what's needed in the workforce right now. She sees this critical need and she's acting quickly and decisively, which we appreciate. And I think it goes hand in glove with the recent program that we did on expanding the number of people we're going to hire and clinical space to meet the growing demand.
Would there have to be a more hiring of faculty and maybe expansion of facilities? I know we talked to UB earlier and they, like, for example, showed us their labs and things like that where the nursing students get hands-on experience.
Ron, that's exactly it. We just put a new program out last week. It's a $3 million emergency nursing training fund. What we're finding is all across the country, and it's no different in New York State, it's no different in the SUNY system. We're getting people to apply to become nurses. We don't have enough space to train them right now. Instructors nationwide, we're finding there's a lack of instructors in nursing programs. What we're doing with our program is allowing our nursing programs, which we have more than 70 of all across New York State, including 12 at UB, to hire critical instructors to meet that demand. We lack space. Some of our community colleges are turning away applicants, qualified applicants for nursing right now. How crazy is that, right, Ron? We have this huge demand. There's a shortage. We can't be turning people away to expand their clinical space and their technology so they can actually train more people in the classroom. So that's going to go a long way, I think, of expanding our capacity and system. Is a $3 million program, and we'll do more if we need to do more. And this goes really nicely with the governor's announcement of doing the scholarships as well. So we want to retain the workforce that we have. We want to get the workforce upskilled from RNs to BSN. We want to give more chances to people who may not financially be able to afford a nursing program. Those scholarships will go a long way, and also expand capacity so we can meet that demand.
And you mentioned the community colleges, so they can be part, because they were explaining to us that, for example, at Niagara Community College, which is up here north of us, they have an LPN program. So would they be factored in eventually with the idea that maybe some of theirs people getting associate degrees could then go to UB to get a full BS?
Absolutely. We want to get people into the healthcare fields immediately. And any way we can do it, we will. Whether you want to go from being a CNA to an LPN to an RN to a BSN, we want to make sure we're giving the entire pathway, and we don't want to be turning anyone away. I was in Rockland Community College, which is, of course, down part of the state, not in the Western New York part of the region. They were literally turning applicants away because they don't have enough space and enough people to train nurses. I was at Cayuga Community College. It was the same thing. They don't have enough instructors. I'm sure you're finding the same thing at Niagara and other institutions right now. We need to expand that capacity, and we want to give anybody any chance to get into the healthcare profession right now, especially in the nursing side, because we need LPNs, we need RNs, we need BSNs, we need nurse practitioners, we need specialty fields, we need literally every type of nurse known to man in order to meet the demand.
Would you eventually, now I know it's a little different with the private, Niagara University, for example, has a college. I mentioned Niagara Community College, and I'm sorry, I don't mean to confuse you, but Niagara University, a private school here, very well known, has a college of nursing. Would you ever foresee that they would go beyond and say, let's even work with some of the private schools to expand scholarship?
Right now, I don't know what the state's going to do. I think the focus on the State University of New York system and the City University of New York system will go a long way. We have more than 70 programs in the SUNY system alone. We usually have about 14,000 people enrolled in our nursing programs across the system in any given year. The problem is we need to get 18 or 19,000 people into these programs, and that's why we need to build up the capacity. The other thing we have going for us on the SUNY side, and we have lots of great relationships with our independent colleges and our private colleges. We work very closely with them a lot of times, but there's an affordability piece to this too, right? Our tuition is really affordable. Scholarships can go a long way, and it's high quality. So I think those things make it sort of attractive to go to the City University of New York system and the State University of New York system first. And plus, we have just an expansive reach, right? We can manage this in a system level all across the state as a master plan, while some other private colleges cannot. But we're all working together because we need publics to step up, we need privates to step up, we need everyone to step up.
Do you have any idea what the average tuition per year now is, or how valuable these scholarships could be?
Tuition at the State University of New York is about $7,000. So it is a real affordable thing, but that's a real value to people too, right? $7,000. And it takes a couple of years to get your registered nursing, your bachelor's of nursing sometimes. That's real money and that's real savings. The other thing that we're doing though, Ron, too, is helping those within the current healthcare workforce, RNs. There's a rule in New York State where eventually in 10 years, you have to get your bachelor's in nursing. We're finding some people just exiting the healthcare system. They don't want to be nurses anymore. They don't want to go through that process. We're also working with those folks. We're working with healthcare facilities, hospitals all across the state to make it easier for people currently as RNs to become BSNs. We are providing a lot of flexible scheduling, some online courses. We have many of our programs that offer online courses built around those busy working nurses right now, with some other incentives to keep them retained in the workforce as well. So it's a lot of different things going on to try to retain the workforce and grow the workforce, because I think that there's a recent report saying that we need to train another 11 million nurses in the United States of America in order to avoid a dramatic shortage. So the crisis situation is there. So we have to do everything we can to train more nurses starting now.
Would you also see this, and then I'll have to watch my time here, as kind of a pathway? I bring that up because of another private institution, which we know here, called UVille here in Western New York. They are now reaching out through some of their programs to try to allow people who are lower income to think about healthcare as a field to get into. And would you see this kind of as that outreach too?
Yeah, absolutely. And that's why when you raised the LPN thing, that was an important concept. We have something called Educational Opportunity Centers in the university system too, which provide free certification and training, especially to low income individuals who don't think they have a chance at higher education. So they may not go into an RN program right away or a bachelor's of nursing program right away, but we can get them excited about the healthcare profession by saying, you know what, maybe go be a CNA, a certified nursing assistant, or maybe go be an LPN. You can get that for free in 10 of our free training centers all across the state. There's one in Western New York as well. And from there, we build you a pathway. If you get that degree or certification in that Educational Opportunity Center, you automatically get enrolled or admitted with no extra admissions fees or anything like that to one of our community colleges, one of our 30 community colleges. And from there, you can keep developing your career goals. So we want to build a really wide pipeline to fit as many people in there at different varying points, so they have that chance of some upward mobility and upskilling as they're moving through their healthcare career. So that's something that we're focused on as well. And as the largest comprehensive system in the country, we have all of those pieces. We have free training centers, we have community colleges, we have our 4-year colleges, we have medical schools. There's many ways we could put this all together for people.
Just one last question, then I'm going to have to go. Thank you for your time. The state legislature had passed that staffing ratio situation too, that's going to start taking effect next year for the hospitals, like 1 to 4, 1 to 5. Of course, as you may know too, we had a strike out here, a pretty bitter strike with our Catholic health system over this issue. Does this kind of go hand in glove with that too, do you feel, since the state is moving in that direction with legislation with mandates for hospitals?
The way I look at this, I do the education side, but I think it's not mutually exclusive. The need to train more people and protect the public safety and health of a system. And the legislature and the state thought it was important to have in ratios to protect our healthcare heroes, and nurses are healthcare heroes, and they've gone through a lot. So we want to make sure you have a workforce that feels valued and protected, and their health and safety is protected. But we also need to grow the number of nurses in our society as well. So I think these things work together. I think even if you put aside the laws, Ron, there's been a growing demand for many years. These studies going back to 2016 showing that if we don't do something to increase the output and production of degrees and nurses coming out of our colleges and universities, we're going to have a shortage. So I think this has been happening for a long time, but I think these aren't mutually exclusive things. We see a need. and we're here to help make sure we meet that demand.